to the, for instance, nursing home or residential area, so that we can, the connect and seamless treatment or service providing to the community basis to people. So that's the important thing. But because of the lot of fragmentation of the healthcare providers in Japan, it is historical issues. But it's very, very challenging in the community level to how to connect to all the service providers in healthcare industry.
And in a hospital level, what is the challenge?
Yeah. Well, hospital level, for instance, my hospital is an orthopedic specific hospital, so that our aim for patient is to let them go back to the normal activity level in their own houses or residential area or even community. So our challenge at the moment in our hospital is how to know the patient background, even families or neighbors or communities. For instance, in my place, I mean, in my city, many patients live in a slope area, so that patients complain after discharging the hospital. It's difficult to go up from the road to their house because of steep slope. So even that case, we have to take into account when patient go back home. So what we are doing is not only the doctors or nurses or physiotherapists. What we do, we are taking the on lot of social workers, so that social worker can communicate patients and patients' families and even the care managers in community level. So that's how we are doing. But problem we are facing is still doctors keep the strong power. So which I personally think they need to empower all the power to the medical social workers, so that the patients are happy to go back home easily.
So you think the best approach to this issue is social workers taking over and helping the aging society?
Well, as an Asian culture, still a lot of people believe the hierarchy. Doctors knows everything, but it's not anymore true, as you know. Most of the people knows. So what we need to do is build up team, not only doctors. Doctors should concentrate on the surgery or seeing patients, and then once he or she decided or treat the patients, patients can be nicely treated by nurses or other team members. So who is in charge of building team? That's our challenge.
I see. So besides empowering social workers and the rest of the team, is there any other challenge that your hospital is coming across?
Well, actually, the manpower is not so enough, not enough at the moment. So still, we need the personnel or manpower for help the healthcare in as an industry, and especially long-term care is the challenging for society at large in Japan because of aging society. Having said that, if you look at the data, 80% of older than 65 people are healthy enough. So at the same time, we need to keep them healthy and happy life. So as a healthcare provider, we should not we should think about not only the treatment but also the prevention. That's our challenge.
I see. Do you see any any trends in the healthcare industry in Asia in the future?
Well, in Asia, the tendency is pretty, moving fast. Not only not only ASEAN countries, but also India and the Middle East countries are moving uh, along with the development of technologies. So uh, that's another reason why doctors need to empower to the even machines, not only the people. So we have to change. I mean, as a doctor, we have to change a lot of mind. Yeah, yeah.
Good, good to know. Have your objectives been met at Hospital Management Asia?
Oh, this meeting. Yeah, this meeting was exciting. I mean, I was excited about this presentation today. And yeah, this is good opportunity. And fortunately, I don't see many delegates from my country, which is Japan. And it's sad. But yeah, I think as an organization, you will be expand more, not only in Asian countries, but also East Asia, China, and Korea, and also Australia. So that will be exciting.
Yeah, it will be. It will be exciting. I'm sure we would. We will expand. So, is this your first time at HMA? First time at the event?
Well, this is the second time for me. Last year, I attended this meeting in Myanmar. So also that was the first visit in that was the first time visit in any ASEAN countries except Singapore. So this is the first time to visit Vietnam for me. So yeah, that was good.
That's great. So I can ask you maybe what do you like the most about Hospital Management Asia, about the conference and the awards as well?
Well, I think the most of the delegates, it's a good opportunity to exchange their challenges and also the modern management skills. But again, as Asians, we should think about Asian culture because who we are treating is local people, Asian people. So we shouldn't forget about who is our patients or who is our customers.
Thank you very much. Thank you.